Well, hi everyone, it's Pete here from the Pain Toolkit. Yes, we're back again doing a second video. Still with Katie Napton. Hello, Katie. Oh, you had a tea break yet?
Yeah, thanks, Steve.
Hey, listen, guys. This video is about how to um, have a better consultation, I think, with our healthcare professionals. Listen, this COVID business, it's threw everybody a curve, really. You know, we're used to seeing the doctors and healthcare professionals face to face. But because of COVID, everything's gone online, etc. Now, Katie, I think would you agree with me that some healthcare professionals they may be struggling because they're so used to seeing people face to face that to actually do things on the telephone and video is a bit strange for them.
Yeah, no, there's definitely been a struggle on actually swiveling their approach, and some are still struggling with it. And the ones who have managed to swivel quite well are doing great, but we still need to help patients get the most out of it as well.
That's why I reached out to you, actually, Katie, because I know you're a physiotherapist and you do all your I'm guessing most of your stuff now is online, and so you obviously you've had to learn a few extra skills along the way, like, and I've got that when we've done some interviews before. But so what myself and Katie we come up some not a 10-point plan, but some like 10 simple really ideas about how to have that better um, experience, I guess, working with, having a consultation with a healthcare professional. And I think, like the other ones we did with it, the other 10-point plan for the, or suggestions for the healthcare professionals, preparation is key. You know, you can have all the information and whatnot, but it's all about preparing for that, for that consultation. So it's just simple stuff like making sure that you're not interrupted. I think that's the main thing is that, when you're having that consultation, you're focusing on that thing. So being in an area where you're not going to be disturbed, etc. You know, sometimes, what I've learned over the years that if I'm going to go and see a healthcare professional, I actually might give them a heads up, look, say their doctor or the nurse Joe, I'll go and see, Joe, I'm coming to see you soon. These are the couple of things I'm going to be discussing with you, So it's giving them a little bit of a heads up on what I'm going to be talking to them about. But the main thing again is preparation. Make sure that I think the take-home message from this video really is that if the healthcare professional doctors giving you those some guidance, instructions, and all that, that you've actually understood it. Now, listen, I know us lot, we can say, yes, doctor, I understood everything that was going on, but really you're thinking, well, what do they say? So you've got to take that time. And the healthcare professionals I've spoken since over COVID, they actually quite like this because they feel they've got more time. Because I think when they're sometimes face to face, in the surgery, they're aware that the waiting room's rammed, and they feel pressure that you may have to get, well, you've only got 5 minutes, etc. But a lot of the healthcare professionals are telling me that they feel that they've got more time now to spend with you, So don't take your time, don't feel rushed. Check back with the healthcare professional that you've got everything down, you understood what anything that you've got to do. I think one of your ideas, Casey, was about have some space there. I forgot about it. One that when you what was that one you said about if you saw
Yeah,
the
no,
viewers?
so if you're doing a video consultation, it actually can be quite an interactive experience rather than a passive experience, and you may well be asked to move. So just check that you're in an area that potentially you can move and show some movements and show how you're moving, so the healthcare professional can assess that as well. And I think, yeah, I think you've covered most points, Pete. And as a patient, it's your appointment. Make the most of it. So as Pete said, prepare. What do you want to get out of it? And especially if you have any sort of long-standing pain issue or disease that you're trying to get some sort of solution or some way forward or plan, check that you've got an idea of what you want out of it. But it's got to be, it's got to be realistic. So bear that in mind. But don't see these appointments as an inferior model. Okay, they can be good quality appointments. You can go away with some really good stuff from them. So really try and treat them seriously. Prepare, check you've got your information, check in the appointment that you're listening, and as Pete says, you understand it. And you've got a plan moving forward. They should give you that. So especially if you're seeing, say, a physio or, you know, anyone like that, you should be given some information to take away. And if you're not, that's not good enough. So email them, contact them. You need to go away with stuff. You need to know where you're at. If you're going to the doctor for a specific reason and you needed a prescription, they will give you the prescription. So you should get the same whatever appointment it should be.
Hey, can I ask you a question? I don't know if it's relevant or not. Would it be, I guess, with the doctor's permission or the healthcare professional's permission, would it be so that they don't miss anything? Would it be that to ask the doctor or the healthcare professional, could they record the telephone conversation or the video?
Absolutely, yeah. No, I mean, if it's you recording your own, it's your appointment. There is no problem. It is worth you just checking. But that, you know, certainly as a physio, I have no problems with that, and we record some of our sessions to actually for training and monitoring purposes. But obviously, we'd always ask the permission and check that people are happy with that. But if that's a way for you to move forward, but even beyond that, you still need something else, I think. But yeah, if you're someone who misses something or you want to go through it perhaps with a relative or a friend later because you're not quite sure you've onboarded what they've said, then yes, but definitely just check you ask permission. But if it's your appointment, it shouldn't be a problem.
Katie, fantastic. I'll tell you what, we need to do more videos. I'll tell you what, I think we're a bit of a winning team going on here. Listen, guys, thanks very much for tuning in, watching again another Pain Toolkit video. And also, I think Katie's got a physio fast online. So if you need a physio appointment or something like that, just go via the website, etc. Katie, thanks very much for your time. I really appreciate it. And I'll see everyone again on another Pain Toolkit video. Take care now. Look after yourselves. Stay safe. Take care. Ciao.
Bye.